Good morning, my gosh. Good evening, everybody. Thank you for joining me tonight for Tuesdays Are for Tips, except it's not Tuesday, it's Wednesday, because I wasn't feeling very well last night, so I had to postpone the video to tonight. So tonight we are going to be talking about the benefits of hiring a doula. So, let's get started with, I wanted to first address that a lot of people are confused about what a doula actually is in comparison to a midwife or, an obstetrician. So let's start there. An obstetrician, is your normal doctor that mostly everyone usually sees during their pregnancy. Is anybody else seeing a fuzzy screen? Or are everybody else all good? Okay, maybe it's just you. Sorry about that. Sorry, Con. So an obstetrician is, a board certified medical doctor that receives, a medical degree, has a residency, etc. It's blurry. I don't know, guys. I don't know how to make it not blurry. I'm sorry. I'm not sure how to fix that for you guys. Hopefully the connection clears up. I'm not sure why it's blurry. I can try to refresh. No, that's not its turn. Well, I'm just going to keep going. So an obstetrician is a doctor. They're surgically trained to perform cesarean sections, and also they can provide circumcisions or any other medical surgical procedures you might require after birth. A midwife is someone that is also trained to provide prenatal attention as well as deliver your baby. They do not provide any sort of surgical procedures. In the event that you need a surgical procedure after your baby is born, they'll need the help of an obstetrician. So let's move on to what a doula is. A doula is not medically trained. A doula is a support person that you would hire to support you during your pregnancy, your birth, and postpartum. It's not telling me that it's slow. I'm sorry, guys. Hopefully it remedies itself. So a doula in ancient Greek actually means woman who serves. So in a 2012 survey in the United States, it was found that only about 6% of women hire a doula to support them during their births, which is really low. And hopefully, it's starting to increase, but it's still really low. And I'm going to tell you why you should absolutely hire a doula. So like I said, they're not medically trained, but what they are there to provide you is both physical and emotional support, and also information that you can tap into, knowledge about pregnancy and birth and labor and how to help you throughout that whole process. So they're there during your pregnancy, like I said, through delivery, and offer postpartum help. So they teach you, birthing techniques, exercises you can do. Doulas are for dads. We'll get to that. Techniques you can work on, exercises you can do during pregnancy to help you when your big day comes. They also provide physical support in the way of counter pressure or massage during your labor and delivery. They can help you create a birth plan. So, what you imagine your day to be, they can help you put that down on a paper, which can help your medical staff when you go into labor to help make sure that things go the way that you hope that they go. But unlike a midwife and a doctor, they're not board certified. This is not a profession that is regulated by any sort of board. There are certification processes that people can go through to receive training to be a doula, but it's not regulated by any sort of, a board that looks over everybody like a doctor would be, or a lawyer. So what are the benefits of hiring a doula? They offer continuous support. So a lot of people, they think, oh, it's fine. When I go to the hospital or, the birth center, I'll have my nurses there. It'll be great. They're going to support me. No, they won't. A study found that the nurses spent about 30% of their time in your room while you labor, or 30% of the time that you were there in your room while you labored. So 70% of the time, nobody is in there with you except for your partner, your birthing partner, or, whoever else you happen to bring with you. And while they're in there, they're not providing you any sort of support. They're checking your vitals, they're checking your blood pressure, they're making sure you have fluids, making sure maybe you went to the bathroom. They're not there to provide you with any sort of birthing support. It was found that about 12% of their time may or may not be spent giving you the support that you need. So doulas will be there 100% of the time. They will be there when you call them that you're in labor. If you need them, they'll come to you at your house, or they'll show up, when you need them at the hospital or your birth center or your home birth. They will be there until you tell them to leave, until you tell them to go home. Or, in the event that your labor is really long and they need to rest, they may call their backup to help them in the event that they need to catch a couple hours of sleep to make sure they provide everything that they need to provide to you. There's also a reduced chance of having a C-section, a huge reduced chance of having a C-section. In the United States, 1 in 3 women that walk through hospital doors to have a baby will end up on an operating table. So about 32 to 33% of women will end up having a C-section that deliver in a traditional hospital setting. This is ridiculous. The ACOG, which stands for the American College of Gynecologists and Obstetricians, they say this rate shouldn't be over 10% because at the end of the day, a C-section is an emergency surgery. It should not be used unless every other possible avenue has been approached. But that's not how things are really done in the real world. So having a doula actually lowers your chance of about 50%, give or take, of having a C-section. So having someone there to support you lowers the chance of you needing that sort of intervention. Additionally, there's less need for Pitocin. So Pitocin is a synthetic drug that they give you to help stimulate and maintain contractions. This is a synthetic version of a hormone called oxytocin, which your body produces naturally to help stimulate contractions and have labor progress. What Pitocin does is it actually makes your contractions a lot stronger and a lot more painful. But having a doula there can prevent you from having this Pitocin drip, or maybe end up having a lower drip of Pitocin, because having a doula actually stimulates your own natural production of oxytocin. I don't know how, but a lot of studies have found that women that have that positive birth support, their body actually produces more oxytocin, which helps labor progress faster, smoother, and more efficiently. But Pitocin is often introduced either to induce labor in the beginning, or in the event that an epidural is taken. Usually the body doesn't respond well to epidurals, so you need Pitocin to help your body continue to labor efficiently, and sometimes on a time schedule that the hospital wants you to adhere to. But this drug is actually a lot more painful to you because your body doesn't send out pain-numbing hormones in response to Pitocin, but it does to oxytocin. So when your body produces oxytocin, your body actually combats the pain by helping you numb almost. So Pitocin definitely has its place, but it should only be used when it's absolutely necessary. And having a doula there can actually decrease your need for having Pitocin because your body is creating more oxytocin. They can also help you, with changing your position, breathing through your contractions, and working against that fight or flight response, which is your adrenaline, which is really not a good thing during during labor. Next, they can also lessen the requests for an epidural. So a lot of women go into having a baby knowing that they're going to have an epidural, which there's nothing wrong with that. But some women actually never even request it, because it's weird. Actually, having a doula kind of acts as a drug to you, that they report having felt less pain and not requiring the epidural. So don't confuse what I'm saying to be that the women that are hiring the doulas are going in already knowing that they don't want an epidural. These are women that went into birth knowing that they wanted an epidural, but never got to that point where they requested it because of how their doula was working with them and with their birth partner during the labor process. Having a doula can also help you have a faster labor. It's shown that hiring a doula can shorten your labor by 40 minutes to an hour, which is a huge amount. If my first labor could have been shortened by an hour, that would have been great. My second labor was really, really fast, so I don't think I would have wanted it to be any shorter. But I did have a doula for both of them. So, but quicker labor, like I said. Since your doula is helping you breathe through your contractions, move positions as you need to help your body push your baby down into the birth canal, help your body dilate, you're going to spend less time huffing and puffing and getting, overexhausted, overexerted, because they're helping you and helping your birth partner labor efficiently and effectively. It's also found that hiring a doula results in a reduction of the need for forceps in a vacuum. So towards the end of your birth, if you're not pushing efficiently, either because of the epidural or the Pitocin, or you're exhausted, doctors might say that if you don't birth this baby on your own in the next 10 minutes, then we're going to do it for you, using a vacuum or forceps. And this is not a good thing, because it can actually damage the baby's head and it can actually hurt you a lot more. But having a doula there, again, helps you push efficiently. They help you rest when you need it and give you, water or coconut water or a snack or something to help fuel you and help motivate you and support you while you push your baby out, and also can help you advocate for yourself. So they also result in an increased beneficial experience. So a lot of women find that hiring a doula, they actually enjoy their labor a lot more, which I know is kind of weird to say, because a lot of people associate with labor and delivery with extreme pain. And how could you ever enjoy something like that? Well, that's true. You're going to be in a painful, uncomfortable situation, but at the same time, there are a lot of ways that it could be a lot worse than what it is. And that really has a lot to do with the people that are attending you, your physician and your nurses. Moms have also found that with hiring a doula, they have higher breastfeeding success. A lot of doulas are trained in lactation, whether board certified or just a lactation consultant. Or if they had been mothers themselves and breastfed their babies, they can offer guidance to help you latch when your baby is born. Now, mostly all babies are born with full tummies. So a lot of people are pressured into getting their babies to latch when their baby is born. The hospitals want your baby to nurse right away, but more often than not, your baby's going to be very tired and not hungry. But if you can get them to latch, then, the staff will kind of back off. And a doula can help you achieve that latch. And then eventually your baby will start nursing when your baby needs that nutrition again. It could be right after birth. It could be hours after birth. Both of my babies didn't nurse after delivery. They were very tired because they had just run a marathon trying to get out of my body. And then lastly, they can help in the event that any interventions are introduced in how to handle those interventions, providing any of the support that I mentioned. Hiring a doula, you'll have higher chance of a spontaneous vaginal birth, meaning that you go into labor on your own without being induced. they can lessen your request for pain medications. They can help you have a better, more positive experience, and greatly reduce the risk of having cesarean section. Another thing is that they, some babies that, if your labor goes a lot longer than maybe it should have, the physician does something what's called an APGAR score after your baby's born, which is basically just a 5-step rating that they do to determine whether or not your baby needs immediate help. And since you've hired a doula and your labor was a little bit lower, it has actually showed that babies have better APGAR scores when they're attended by a doula. So these APGAR scores, it has to do with activity, like their muscle tone, their body movement, pulse, grimace, or their reflexes. Your appearance, the appearance of the baby, so what their color is when they come out. A lot of babies are blue and then they don't turn color, back to normal color as quickly as they would like them to. Respiration and how they're breathing. So those are some immediate benefits that they can offer the mom during labor, or that, the benefits for labor and helping it progress and helping it be efficient. But as Conrad mentioned, doulas are also for dads. So, or I shouldn't say just for dads, they're for your birth partner, your other support person. And how do they offer this support to your birth partner? Well, they offer physical support. So often your birth partner might be extremely overwhelmed, in labor. Maybe they've never experienced this before. You may have never experienced this before. They don't know what they're doing. They don't know what you're going through, but a doula does know what you're going through and has seen this before, and they can help. Yeah, they can help your birth partner become more physical with you. If that's the kind of touch that you need, they can help lead them into touching you, massaging your back, or doing counter pressure on your hips. A doula is not there to replace your birth partner. A doula is there to help your birth partner give you the support that you need. And sometimes you need both of them at the same time. For instance, maybe you like hanging on your husband, wrapping your arms around his neck and just hanging and feeling weightless. But at the same time, your doula is applying counter pressure on your back because you're having back labor, or you're just tired and you're having spasms and you need some massage support. The doula can also, like I said, help your partner touch you. And then, if your partner gets exhausted, which they can, they're allowed to get tired too, because they're also going through, a marathon, an emotional marathon. They're exhausted. In the event that they need to go get a coffee, go to the bathroom, get a bite to eat, your doula is there to swoop in and make sure that you have support while they step out to recollect themselves or get whatever it is they need to come back in and be the person you need them to be, which is super great. My husband, Conrad, he was super exhausted during our first baby's birth because I labored for about 36 hours. He had worked a full day, came home, I went into labor, and she wasn't born for another day and a half. And I actually told him to go to bed. He needed to sleep because he was at the point where he is not helpful to me. So I sent him away, he slept, and then he came back refreshed, right in the nick of time when I was ready to start pushing Blair. And it was great. My doula was there to support me in his absence. She was there the whole time to support me, but even more when he was getting the rest that he needed. So there's also emotional support. One of the toughest things that my husband told me about me giving birth to our children was the fact that he had to watch me give birth to our children. He knew how much pain I was in, and he knew the discomfort I was in and how exhausted I was, and that was really tough for him. But luckily, our doula was there to reassure him that everything that was happening was not only normal, but it was I was going through the steps of labor, and that, she's here and soon this baby is going to be in her arms and it'll all be over. You're doing a great job. You just need to know not to be worried and just be there for her however she needs you to be. And, it could be hard for your birth partner to see you in this state, and having that positive reassurance there will help the overall tension in the room, the overall atmosphere in the room, knowing that there's nothing to be afraid about. We're all here, we're doing this, you're working towards having this baby, and the baby's gonna come out and we just need to work through it together. Also, your birth partner is your advocate. If you're birthing in a hospital setting, hospitals birth babies or help you birth babies in a certain way. They have policy they need to stick to. They have red tape with insurance companies, protocol, blah, blah, blah. You need to do this, you need to do that. Having a doula there will help you make decisions by providing knowledge to you. They won't make decisions for you, but you can use them as a sounding board to get some information to help you make educated decisions based off of what you perceive your ideal birth to be. They are an unbiased kind of medium, because there's you that wants your birth to go this way, and then there's the hospital that wants the birth to go this way, and then there's somebody in the middle that kind of can help both sides navigate a little bit better, if that makes sense. Also, providing for the birth partner is time. So, you go into labor on a Tuesday at 1:00 in the afternoon, and your husband's at work. He's at a sales meeting in San Diego and you're in Orange County, and oh my gosh, how is he gonna get here in time? I need help. Call your doula. Your doula will be there right away whenever she can. I say she because more often than not, a doula is a woman. I've only heard of one instance where there's been a male doula, which I think is super awesome, but more often than not, it will be a woman. So if you need to get home from work to help your laboring mama, or, you have other things you need to take care of, you have other children that you need to go drop off at grandma and grandpa's house, guess what? Your doula can help you. They can come to your house, help your mama labor at home while you take care of all the necessary things that need to be taken care of before you guys go to the hospital, etc. Hi, Sarah. Time support. Yes. So lastly, how they're great for dads is that, again, they provide a sort of education for you. When your mama is laboring, she may not be, of great sound mind to ask the questions that need to be asked. And, you might feel like maybe I shouldn't ask these questions to my doctors or my nurses because this isn't really their job. And a doula will help you any way that she can with the knowledge that you may need. Again, they're not trained medical professionals. They cannot provide you with diagnoses, but they can give you information to help you make educated choices for what's best for you and best for your family. The birth partner needs to be the advocate for the mom in the hospital, because they will try to maybe do some things that you don't want them to do. For instance, they may give you Pitocin without you even wanting it or requesting it, because that's just kind of the way that things go. So as the birth partner, you and the doula can kind of be this guarding force to make sure that they don't just slip in and quickly inject some Pitocin into, the mom's IV drip, and now she has these, interventions that she didn't want to begin with. So you want a medicated birth. There's nothing wrong with that. So you think maybe you don't need a doula. That is the furthest thing from the truth. Whether or not you want to have a natural birth, unmedicated, or a medicated birth with an epidural and Pitocin, having a doula can benefit you either way. If you go, the epidural route and the Pitocin route, you have a huge chance of having a C-section because of these interventions. In a study that I read about, they provided a group of women with doulas and another group of women without doulas. They had not, screened them for what they wanted as far as their birth, whether it be medicated or unmedicated, and they found huge drastic results because of this. The group that Okay, let's back up. The group that didn't have doulas, 25% of that group ended up with a C-section. The group that did have doulas, only 13.4% ended up with a C-section. So the C-section, the C-section rate was even more drastic between the two of them when it came to having inductions, i.e. Pitocin and maybe an epidural, to the ones without a doula being 58, almost 60% getting C-sections, and the ones that did have a doula, 12.5% had a C-section for the ones that were medically induced. That is a humongous difference. I mean, that's what, 48, 46% difference between the two. Labor-induced, 60% ended up on an operating table that didn't have a doula, and less than 13% ended up on the operating table that did have a doula. So medicated or unmedicated, hiring a doula can greatly help you prevent having a C-section, which in my opinion is huge. I personally really wanted to do everything I could to avoid having a C-section because I had abdominal surgery before. I had to recover from having abdominal surgery, and I really didn't want to have to deal with that after also having a newborn that I now have to take care of and feed and clothe and change diapers and try to get sleep, but also I'm recovering from having major surgery and also maybe any complications that stem from that. So, what is included when you hire a doula? Well, all doulas are going to offer things different from another doula, but for the most part, this is what will be included. You'll get 1 to 2 prenatal visits to discuss your expectations, concerns, or birth plans. So that means that they'll either come to your house or you can meet them at a coffee shop, something like that, before your baby is born. Usually when you're full term, like at 37 or 38 weeks, they'll have this meeting with you to discuss your birthday. They'll also offer you any sort of advice you need during pregnancy for labor and delivery, such as exercises, breathing techniques, to help you prepare for labor and delivery. They provide unlimited support via email, text, phone, just a text message away. Let them know how your prenatal appointment went, how that ultrasound went, what gender your baby is, etc. They're there to help you with any questions you might have, or just to help, with all the excitement and help you prepare. They also provide unlimited support for the mother and unlimited support for the birth partner. Labor attendants. So they will be there for your labor, the whole thing. They will be there when you think you need them. You call them when you think you need them, and they will come a-running, whether you're still at home or whether you're on your way to your birthing place. Now, they'll stay with you until you tell them to leave, pretty much, or they'll stay with you up to 1 to 2 hours postpartum. So that means they could be with you, anywhere from, 5 to 20, 30 hours. And so keep this in mind when you're hiring a doula, because doulas need rest too. So if you have a prolonged labor, it might be beneficial for either you to let her go home and get some rest if things have stalled or slowed down a little bit, or she can provide her backup doula, which you really want to make sure your doula has a backup in the event that, she's been with you for 30 hours and she just needs to get some rest, because let's face it, we're all human and we all need to sleep every now and then, especially when something as labor intensive as giving birth to a baby. So having a backup doula can help them in the event that a prolonged labor happens, or if there's a situation where your doula can't attend your birth, which happened to me. So I am so thankful that I had a backup doula, because when I went into labor with my first baby and I called my doula, she said, "Allison, I'm so sorry. I have a family emergency. I cannot come to your birth." Yeah. Which, you know what? I was okay with, because she said, Melissa is ready. She knows you're in labor, and she's ready for you whenever you need her. And I was 100% okay with that because I still had somebody that was going to help me. And Melissa was incredible, and she attended both births for my babies. So in addition to attending your birth, they may offer other things such as rebozo, which is a belly band thing that they help, move your baby around if you need that. They can offer birth accessories such as a birth ball or a peanut ball or a squat stool, massaging, apparatuses, etc. Essential oils if you want them, and also maybe even a postpartum care kit. My doula provided that for me, and it was super awesome. So then also they will provide you postpartum support. So your baby is born, your baby comes right onto your chest for that at least 1 hour of bonding called the golden hour, where they get skin to skin contact, help them adjust to their new world. And usually your doula will stick around, outside the room while you are bonding with your baby, and then come back in when you are ready to check on you, make sure you have everything that you need, and then they'll be on their way. Some doulas will also... What's your question? What's the question marks? Oh, no! Are we back? Are we back, guys? Maybe? Hello? I'm gonna keep talking. Maybe we're still there. Anybody? There? Yes, maybe? Okay, well, I'm gonna keep going. Some will even come to your house, a day or two after you've had the baby to check on you, check on your recovery, and help you with breastfeeding in the event that you need that. Okay, good. We're back now. Awesome. So those are some of the things that can be included in your doula services. Like I said, some may differ a little bit from that, so you'll just want to communicate with your doula, prospective doula, to see what is included in their fees. What is not included? Okay. Doulas are not medical professionals, like I have said. They do not perform vaginal exams. They do not check your heart rate or your baby's heart rate. They're not going to give you strict medical advice about what is happening to your body. They'll give you tips to help you cope with what is happening to your body, but they do not diagnose your condition or tell you what is happening medically with you, because they cannot give you medical advice. They cannot and they should not project their own beliefs onto you. So, like I said, if you want to have a medicated birth, your doula, who maybe had an unmedicated birth, should not project that onto you and force you or make you feel like you're doing something wrong because you want to have your birth a certain way. They'll not take over the role of your birth partner. They're there to support both you and your birth partner. They do not catch the baby. That's either your doctor, you, or your birth partner will catch the baby. And like I said, they will be there the whole time. They won't change shifts. So they'll be with you, up to 24 hours unless you tell them to go home. So they provide so many services for so much time, and some are, this is reflected in a lot of their fees. So what does a doula cost? A doula can cost anywhere from $0 to $1,500 plus. So how do you get the $0 one? I'm going to tell you about that. How can you find a doula? Referrals are a great resource. So if you know a mom that has used a doula, talk to her about where she found her doula, if she liked her doula, and if she did, maybe she'll hand over, the digits, and you can give that person a call. That's a great way to find a doula, is if you know someone that used somebody. Alternatively, you can also go on something like Yelp to search your local area to find a doula. There are also professional organizations that you can search called, one's called dona.org, that's DONA.org, or doulamatch.net. So I suggest that you interview at least 2 to 3 doulas if you can, to see which ones you click with. And again, like I said, some will offer certain things and, you know, different from others. So you're going to want to see what works best with what you envision for your labor and your delivery. I suggest you hire them as early as you can. I didn't hire my doula the first time around until I was about 24 weeks pregnant, because I didn't know what a doula was until then. So once I found out how I wanted to have my baby, I said, we need help. So my husband and I totally agreed on this, that we needed somebody to help us. And then that's when we found our doula. But I would hire even earlier. With my second baby, Declan, I hired them again. I don't know, maybe I was 10 weeks pregnant when I hired them, because you get that support via text, email, phone, etc. Once they're contracted. So they'll be there, you know, whenever you need them to, you know, vent about how you're feeling or just have somebody to be excited with, etc. Use them because they're there. So you'll want to also try to find them early because, you know, they get snatched up. So you want to make sure you get the one that you want, because once they, you know, they only take a certain amount of births per month. And once they fill that window where your birth is going to be, they may not take on another mom. So, or you might not find someone in your little geographical area that you wanted, and now you have to look out here, and now they're going to be further away. So if you want to get a doula, get one as early as possible. So how do you get one for free? Well, it's pretty hard, but you can hire a doula in training. So someone that's working towards, you know, getting certified, or maybe is just starting out to, you know, do this as a profession. My experience with a doula is phenomenal. I loved having someone there to help me stay calm, help me focus, that has experienced this multiple times and knew that everything that I was going through was natural, and also helped keep my husband calm and focused and in the moment. And I honestly don't think we would have gotten through it, either of my births, without having a doula. I did have unmedicated births, but I have girlfriends that had medicated births that hired doulas, and they would say the same thing. So that's pretty much going to wrap up why you should hire a doula. But I do have a little bit of an announcement. I'm not pregnant, but I am actually going to start offering doula services. I am working towards getting my certification in August, but I am going to be attending my first birth in July, which I am super excited for. Yeah, Kelly, not pregnant. So I am going to be working towards getting my certification through Doula, which is DONA, and they are a huge training company that offers workshops for doulas. And so if you're interested in my services, you can find out more about that on my website at downhomemama.com, and then you can just click on the doula tab and it'll take you to my story and offering and yada yada yada. Alternatively, if you're looking for somebody with a lot more experience, I can also help you with that by providing some referrals to you if you are in the Orange County area. So DM me if you have any questions, comments, or concerns about hiring a doula, how to do it, and if you need a referral. Otherwise, next week on Tuesday night, we're going to be having our last video for now until I plan more. Originally, it was going to be about nuchal cords, which a lot of people don't know what that is. It has to do with the umbilical cord, but I'm actually going to kind of expand this topic a little bit, excuse me, to talk more about facts you may not know about labor and delivery and postpartum. So I'm going to be talking about nuchal cords, and then also a few other interesting facts that you may or may not know about. So I hope you join me then next Tuesday at 8:30 p.m. And if you don't have any more questions, comments, or concerns, I will be signing off for the night. And I hope you all have an incredible evening. And I'll see you next time. Bye.